conjunctivitis. So, Bismillahirrahmanirrahim. Today our second topic is inflammation of conjunctiva leads to conjunctivitis. You may have some experience of conjunctivitis, sometime bacterial infection, sometime viral infection, sometime allergic reaction. So we're going for conjunctivitis. What it is, you can see this inflamed eye over there. It's a true simple example of conjunctivitis. Newborn, they have also conjunctivitis. The closed eyes, when they used to, in the morning when they open, the eyes lids are closed. It's also example of conjunctivitis. So what's a conjunctivitis? How the definition of conjunctivitis is that conjunctivitis is an inflammation or infection of the transparent membrane conjunctiva that lines the eyelids and covers the white part of the eyeball. When small blood vessels in the conjunctiva becomes inflamed, they are more visible. This is what causes the white of the eyes to appear reddish or pink, also known as pink. So what happens? The lines the eyelids and covers the white part of the eyeball. When it's infected, it has to become red. When a small blood vessels in the conjunctiva becomes inflamed, they are more visible. This is what causes the white of the eye to appear reddish or pink, also known as pink eye. So it's a conjunctivitis leads to a pink eye, the red eye, pink eye mostly. So risk factors: exposure to something for which the person have an allergy. So if that is known as allergic conjunctivitis, so mostly it happens that when you apply these contact lenses, they leads to allergic conjunctivitis. Exposure to someone infected with the viral or bacterial form of conjunctivitis. If you have exposure to viral or bacterial, that leads to viral or bacterial conjunctivitis, or the person who are using contact lenses, they leads to conjunctivitis. Causes: viruses, bacteria, allergies, or a chemical splash in the eyes. They also leads conjunctivitis. If a foreign object go to the eye, it also leads to conjunctivitis. In newborns, a blocked tear duct can cause the conjunctivitis. Now types, first viral and bacterial conjunctivitis. So viral conjunctivitis and bacterial conjunctivitis may affect one or both eyes. This can happen in one eye or on both eyes. It may cause viral and bacterial conjunctivitis. Now viral conjunctivitis usually produce a watery discharge, and bacterial conjunctivitis often produce a thicker yellow green discharge. Now the discharge is different. If there is a viral, they will only produce a watery discharge, and if there is a bacterial, it produces thick yellow-green discharge. Now both viral and bacterial conjunctivitis can be associated with colds or with symptoms of respiratory infections such as sore throat. So if you have cold or sore throats, they can lead to conjunctivitis also. Both viral and bacterial conjunctivitis can be associated with colds or with symptoms of respiratory infection such as sore throats. It leads to viral and bacterial conjunctivitis. So both viral and bacterial types are very contagious. They are spread through direct or indirect contact with the eye secretion of someone who is infected. Adults and children alike can develop both of these type of pink eye. However, bacterial conjunctivitis is more common in children than in adults. Now, allergic conjunctivitis. Allergic conjunctivitis affects both eyes and is a response to an allergy causing substances such as pollen. So, in response to allergens, the body produces an antibody called IgE, that immunoglobulin E. So, most allergic conjunctivitis can be controlled with allergy eye drops. Now, conjunctivitis resulting from irritation from a chemical splash or foreign object in the eye is also associated with conjunctivitis. Sometimes flushing and cleaning the eye is done to get rid of the chemical object causing redness and pain. So what you have to wash? Clean the eyes with plenty of water so this can be treated. Pathophysiology of this. So what microbes enter the eye on contact with infected objects. They produce inflammation of the eye, dilation of blood vessels, eye, then producing swelling, redness, exudates, and discharge. Symptoms mostly are there's pain in eye, redness in one or both eyes, hyperemia, itching in one or both eyes, a discharge in one or both eyes that forms a crust during the night that may prevent the eye or eyes from opening in the morning. That is, exudation can be reported. Tearing is there, photophobia is there, dropping of upper eyelid, periorbital cellulitis is there, fever as one of symptom. There go for sore throat. There can be runny nose, gritty feeling in one or both eyes. This see that congestion is there in eye. You can see congestion is there when there's a chemosis there. When chemosis due to the eye becomes like this, then subconjunctival hemorrhages have been produced, have been found. The eye becomes this. When there is a discharge, so discharge like this has to become from the eyes. Then membrane has to come out. The eye have shown like this. Then papillae has to be have inflamed, so eye becomes like this. Pupilles, then follicles can be inflamed, so eye becomes like this. Membrane has to come out, so eye becomes this swelling of this type. Pus inflamed, the eye becomes like this. How to test and diagnose has to be done of conjunctivitis. So to determine whether the patient have pink eye, the doctor will examine the eyes. The doctor may also take a sample of eye secretions from the conjunctiva for laboratory analysis. If the patient has very severe case of conjunctivitis, the corneas are affected, or if the person have had repeated infections that aren't, if they're responding to the treatment. So treatment for bacterial conjunctivitis, if the infection is bacterial, the doctor may prescribe antibiotics, eye drops as pink eye treatment, and the infection should go away within several days. Antibiotic eye ointment in place of eye drops is sometimes prescribed for treating bacterial pink eye in children also. An ointment is often easier to administer to an infant or young children than eye drops, though ointments may blur vision for up to 20 minutes after application. With either form of medication, expect sign and symptom to start getting better in a few days. Follow the doctor's instruction and use the antibiotic for the complete period prescribed to prevent recurrence of the infections. Topical antibiotics. Ideally, the antibiotic should be selected after culture and sensitivity test. However, in routine, most of the patients respond well to broad spectrum antibiotics, neuroantibiotic drops such as ciprofloxacin 0.3%, ofloxacin 0.3%, or gatifloxacin 0.3% may be used. Antibacterial are used, ciprofloxacin 0.3%, ofloxacin 0.3%, or gatifloxacin 3.3% may be used. These are the quinolones. These are the fluoroquinolones, that is antibacterials. Further, they have to be dark goggles, may be used to prevent photophobia. No bandage should be applied in patients with mucopurulent conjunctivitis. Anti-inflammatory and analgesic, for example, ibuprofen and paracetamol may be given in sensitive patients. So they can add anti-inflammatory and analgesic drugs from NSAID to paracetamol. For viral conjunctivitis, there is no treatment for most cases of viral conjunctivitis. Instead, the virus needs time to run its course, up to 2 or 3 weeks. So viral conjunctivitis often begin in one eye and then affect the other eye within a few days. Signs and symptoms should gradually clear on their own. Antiviral medications may be an option if the doctor determines that the viral conjunctivitis is caused by the herpes simplex virus, then they have to apply. Treatment for allergic conjunctivitis. If the irritation is allergic conjunctivitis, the doctor may prescribe one of many different types of eye drops for people with allergies. These may include medications that help control allergic reactions, such as antihistamines, or drugs that help control inflammation, such as steroids and anti-inflammatory eye drops. The patient may also reduce the severity of allergic conjunctivitis symptoms by avoiding whatever causes the allergies when possible. Lifestyle and home remedies. Apply a compress to the eyes. Try eye drops. Stop wearing contact lenses. Reduce exposure to light. Prevent rubbing of the eye. Clean the eye using sterile water and cotton swab from inner canthus to outer canthus. Use of dark sunglasses is advised if there is a photophobia. Prevention. Preventing the spread of pink eye. Practice good hygiene to control the spread of pink eye. For instance, don't touch your eyes with your hands. Be careful. Never, when there is a pink eye, do not touch eye with hands. Wash your hands often. Use a clean towel and washcloth daily. Don't share towels. Don't share towels or washcloths. Change your pillow cases often also. Don't use eye cosmetics such as mascara, etc. Don't share eye cosmetics or personal eye care items. Although pink eye symptoms may resolve in 3 or 4 days, children with viral conjunctivitis may be contagious for a week or more. Children may return to school when they no longer experience tearing and redness of the eye. If a child has bacterial conjunctivitis, keep him or her away from school until after treatment is started. So in newborns, how it's prevented? Preventing pink eye in newborns. Newborns' eyes are susceptible to bacteria normally present in the mother birth canal. These bacteria causes no symptom in the mother. In rare cases, these bacteria can cause infants to develop a serious form of conjunctivitis known as ophthalmia neonatal. May cause ophthalmia neonatal, which needs treatment without delay to preserve sight. That's why shortly after birth, an antibiotic ointment is applied to every newborn's eyes. The ointment helps prevent eye infection. So family teaching should be prevent transmission of infection, use of good hand washing after touching the eye, use separate towel, sheet and pillowcase for infected child. Do not allow the medicine's dropper to touch the child's eye during medication instillation. So discard old contact lenses and use new ones after infection has resolved. So what you have to do then? While you're applying the eyedropper, it should be above the eye. You do not touch the eye. Similarly, if there's infection by the lenses, so discard the lenses, older one, and have a new contact lenses.